Uh, Ladies and gentlemen, welcome to In Truth and in Spirit Well of Worship Fellowship. Your moderator today, my name is Peter Calviland Silvide, and we are honored to have to have a guest. We have a guest speaker today, a counselor, a psychology counselor, a major in psychology, and probably psychotherapy. She will explain further. Who does counseling and is our boss here at Chambogo University. She helps us counsel students. She helps us counsel teachers. She's a counselor and she's done this work for years, not just as a profession, but as a career. Mental health is has taken toll on us. I think a week or two ago, we were reading one of the headlines, and Butabika had expanded or had meant to expand the VIP section, and the VIP section of that will tell you how significant mental health or mental health challenges are taking toll on us. Yeah, so it is in that spirit. We have mental health, individual mental health, family mental health, children's mental health, due to various reasons, due to various factors. Okay, what causes mental health challenges, or what is mental health? What causes mental health challenges? How can we ensure that we are mentally healthy? Is it part of also mental pathology? Is it spiritual? Is it social? Is it social? Is it physical? What is it? Ladies and gentlemen, I have the honor right now to invite Councillor Winfred to come and present to us, and then later, after probably 30 minutes or 25 minutes, depending on the time she will take, we shall open the floor to Q&A. Ladies and gentlemen, Councillor Winfred.
Thank you very much, Peter. Members, I still want to say apologies for the failure of the laptop. It developed a technical problem. I will use my phone as per now, and sorry that I can't use my phone to share the screen. All in all, we are together, and at this moment, I want to call upon the Almighty Father to guide us, the Holy Spirit to guide us. As he has already mentioned, I'm Winfred Kyosaba Biribonwa. My title is Principal Counseling Psychologist, but I want to say I'm a counseling psychologist, of course, a counselor. I am a mother. I am a teacher. I am a grandmother. I have done counseling in Chambogo University for a period of now, since 2018, counseling. But before that, I did counseling in a clinic. I've done counseling in schools. I'm so passionate about young adults, children, and marital relationships. Yes, I am not saying I do not do any other issues, for example, grief and trauma. I do that. But my passion is around children, young adults, and marriages. So as Peter has already mentioned, there is a lot going on. And remember, this is our family as the beginning of everything. We come from families. It is the smallest unit, but it does a lot. We are coming from families, going to schools for the children. We are going to work. We are going to churches. But where is the core community involvement? It comes from a family. So what does it mean when we are looking at mental health? Unfortunately, I am not going to share some of my nice slides here because of the technical problem. We shall ask ourselves, what is mental health? Many people have defined mental health, and I wouldn't want actually to be the one to say too much of mental health, but we shall refer, for example, to the World Health Organization, where they look at a state of well-being. In us, the individuals, are we in position to realize our abilities? Are we in position to cope with challenges, with the stressors of life? You know, there is a lot happening in our communities. Are we in position that however much we are suffering, whatever challenges we are suffering or we are going through, can we continue being productive? If this is a child at school, is this child in position to continue with his or her academics? If I have Winfred who goes to work to Chambogo, I'll give an example right now. Actually, when the computer failed, immediately I reached home, I was like, God, what is this? But am I in position to continue and I contribute to this session? Or I'm becoming anxious and not in position to talk? That is what we are looking at, a state of well-being. Am I in position to go ahead with life regardless? Sometimes we call it storms of life. They are storms of life. And a good mental health helps us handle the challenges. So if you are not in position to make good decisions, build healthy relationships, it means there is a problem. I want to give a scenario. I hope I can remove my video. Is that okay, members?
It's okay.
It's okay.
It's okay, Counselor.
I would like to give a scenario where a student is preparing for an examination. You have seen me in glasses. And then my glasses, for example, break down. I throw them down and they break. Am I going to focus and go for the paper effectively? Maybe with a small bit of the glass. Or I have been told so-and-so has passed on. Am I in position to continue? If I'm struggling with anxiety or I'm feeling overwhelmed, am I in position to continue with my studies, to continue with my work, or I am having panic attacks? So this means that we have to understand mental health very well. And what does it mean? We have to shower our brains with, if I can say, if you have a can of water, shower. When you go to a shower in the bathroom, what happens? You are feeling fresh. For you to be in position to have good mental health, you are treating yourself. If I have a problem, if I am sick, let me treat myself, then I deal with mental health. I am having fresh air. These days, many people are saying they are undressing, but I want to have fresh air such that I can be mentally sound. So I would like to ask you, maybe Peter and the moderator, I mean the host, will help me out there to look at what are we thinking about in regards to the challenges that we face. How do we feel about it? And what is our behavior? You can put in the chat in relation to mental health. I think I will be in position to read the chat. What are you thinking about when you got to have this topic? What were your thoughts? How did you feel about it? And how did you act, or how did you behave? Or when you have challenges in life, what is it you think about? How do you feel about it? And how do you act? I would like to see at least a few hear from Jethro to let us know some of those comments. I am looking at the chart. I only see, yeah, most of us never realize that we are mentally unwell. I can imagine. That is one comment. I'm waiting for the second. Most of us never realize that we are mentally unwell. Do we have another one? we are never conscious of our mental well-being. Yeah, I'm getting this from one person. I would like members to contribute as we continue, because Peter told me it is an interactive session. I don't want to be a lecturer in here. Another one says the brain does not alert you when it is not healthy, unlike the rest of the body. I hope we do not go into the denials and we leave it at that. I have someone and he says, I know of the fact that we need to create awareness of mental health in Uganda. I still want to say, for this person who has just sent this comment, I would like to know how you feel, how you feel, and how you behave. For example, if you are faced with challenges, if today you were going to the bank and you realized your ATM card was missing, how do you think? How do you feel? How do you behave? Those are the only comments. We can go back to the presentation. Thank you. I can imagine that many times we think positively, we feel positively, and we behave positively. And many times we may think negatively, we feel negatively, and we therefore behave negatively. So what does this mean? It will affect your mental well-being either positively or negatively. So for us as individuals, we strive to become positive thinkers, we feel positively, and we behave positively. However, sometimes it's not very easy, especially when you have not been supported, especially when you have not known that you are thinking negatively, you are feeling negatively. That is why someone there said that we are never conscious. I mean, most of us never realize that we are mentally unwell. The reason why we are here to continue raising awareness. And we have mental health versus mental illness. And what is the mental health being? Are you emotionally fine, psychologically fine, and socially well okay? And for the mental illness, are there disorders affecting your mood? Are there disorders affecting your thinking and therefore affecting your behavior? I normally draw a triangle. That's why I said when the laptop failed, I felt so bad, but I have managed to move on. I draw a triangle and I look at the thinking impacting on how we feel, impacting on the behavior, and then it becomes a rotational business. If the behavior is bad, it is likely to affect my thinking. It will also affect my feelings. So our major aim is to look at mental health positively. There is one friend of mine who normally says, akasinje nokeha. And it is also okay not to be okay. However, when you realize it, what do you do? So before we continue really with this discussion, I would like to give some facts and figures of mental illness. We are so far 10 people here on the call. I want to thank you for joining this call. And we are saying approximately 1 in 5 individuals globally, we experience mental health disorders. This is by World Health Organization 2021. So meaning where we are here, we could be having individuals with mental health disorders or mental illness. However, we don't know. And sometimes I want to say it is the degree that will matter. And we are saying globally, 280 million people are living with depressive disorders. You find someone is moody, someone is very sad, and you wonder what is happening. And then another person says, that's normal. It is okay to keep quiet. No, there is a problem. And we are saying approximately 75% of individuals with mental health disorders are in low-income countries. I imagine our Uganda, which is in Africa, and we do not receive any form of treatment. I want to thank God and the officials, the Butabika members, some rehabilitation centers. They have come up with at least mental health treatment. But how many people know that they need that treatment anyway? We have mental disorders making up to 3.14 of the total burden of Uganda. So when you go to Mulago Hospital, you might find that 3.1 of the patients there have mental health disorders. And at least 14 million Ugandans, this was by Ministry of Health in 2022, that we have some form of mental illness, including Councillor Winfred, who is here talking. But it will also matter how I handle that situation, what support I get, what awareness do I have for me to be able to take care of my mental health. And 25 to 35 attendance at primary health care levels is due to mental illness. You imagine you are going to Chirudu, I stay in Chira, I'm in Chira, you're going to Chira Health Center, but we are saying 25 to 35 attendance at primary health care level is due to mental illness. Meaning, if we are aware of what is happening in our communities, then we shall do better. And the new vision was also showing people 18 to 25 years suffering mental illness due to drug use. Sometimes we take drugs to escape situations and we end up suffering mental health issues. So what are the factors that are influencing mental health? It is possible that biological factors will influence mental health. And when we look at influencing, it is both positive and negative. So if, for example, biologically, if a person with a family history of depression, there is a member of the family with that history of depression, another one can be predisposed. What about the psychological? Someone with strong coping skills, you may be in position to handle stress better than someone who suppresses emotions. There are some people who want to say, I will not talk about it. We shall see when we go ahead of this presentation. Maybe I can say it where people say men should never cry. And as the man is failing to cry, he's keeping a lot on his heart. And then tomorrow you'll hear he's suffering from these hypertension issues. Why? Because I have failed to handle my stress in a better way. What about the social being? If you are in, for example, a toxic working environment, you are likely to develop anxiety, you are likely to develop low self-esteem. And if it is to do with a positive social working environment, then your self-esteem will be high, then you will be in position to deal with some of these issues. And this leads us to some of the common mental health disorders. We are saying common. Winfred, I'm a counseling psychologist, but we also have clinical psychologists. I imagine we could be having doctors here, and I will welcome you people to really make your contributions when time comes. So some of these anxiety disorders, some of these mental health disorders, we have anxiety. You find someone is in excessive worry, can be excessive fear. I normally relate this to when I was still young, and if someone backed at me, and then you send me for a glass that time for us, we used cupboards, not the sideboards, these things. You would go when you are trembling, you are quaking. Why? Because there is that excessive fear. You don't know what is going to happen next minute. So it makes social interactions sometimes extremely distressing when we have anxiety disorders. You may be there and you even fail to make communication. That's why I started by saying, I thank God that even when the laptop has disorganized me, I'm in position to continue. What about the depression bit of it? I mentioned persistent sadness. Some people may feel too much fatigue. Others may have loss of interest in activities they loved. You see someone loved the music, but because I'm going through a lot, I no longer want to listen to that music. If you were a party goer, now you don't want. You'll find that musicians also may stop even playing the music they once loved. Someone may stop wearing a clothes he or she once loved. Why? Because I feel I am not worthy to live. I am useless. Life is not worth living. Those issues come along with mental health disorders. Then we have bipolar disorders. Sometimes they are depressed, sometimes they are manic, they are high up there. You may feel extreme energy, then impulsiveness, and then you go back into depression. So they are there changing the moods. You don't know what is happening, but it is a problem and this can be handled. The trauma-related disorders, you have lost your loved one, you have been, maybe you were kidnapped and you're wondering what happened. Someone, maybe you were in an accident, and this brings flashbacks. And then you have emotional distress. We also have schizophrenia, and this one becomes a chronic mental disorder where people are characterized by hallucinations, they have delusions. Sometimes the thinking is not right. Sometimes the functioning in daily life is also not very right. So as we are there in our families, in our workplaces, in the taxis, wherever you are, what could be the signs and symptoms of poor mental health? We are saying poor mental health, and we said we are all mentally ill. It is only the degree of illness. And then we need to know what is happening. You will see that there are some people who have persistent sadness or anxiety. So if you see yourself, begin with yourself. Sometimes we want to point fingers at some other people. Begin with yourself. You can also, yes, in Buganda here, they say Muganga teyeganga, but you can also look at yourself and say, oh, what is happening? Then there can also be changes in sleep or appetite. You may either eat so much or you do not want to eat, no appetite. You may sleep so much or you may fail to sleep. So this one can also be a sign and symptom of poor mental health. Another one can be difficulty in concentrating. If you are like Peter, who does too much of literature, you want to concentrate, understand a context, and then summarize. Here you are going to fail to do it. And then you begin wondering, oh, is this the Peter who used to do this? There could be something that you need to attend to. Then withdrawal from social activities. Some people want to now withdraw. They want to be on their own. I want to be alone. I don't want to be seen. Sometimes we give examples, but we do not mention the names. You will find, for example, a student who is supposed to be in a lecture room or a classroom, you find him behind the toilets. He's alone. Even when you ask, he will just look at you. Sometimes it is a sign and symptom of poor mental health. Then increased substance use. I imagine there are some counselors on this call, and they will let us know in case time comes and they're in position. You'll find that we have our students. We have not only students, even in the places of our residence where we stay, you find many people. These days, I see very many people on the road, and you're like, what is happening to this one? But most of them is because of substance use. And how did I begin using the substances? Maybe I had a challenge in life. I had a challenge in marriage. I had a challenge maybe at the place of work, my academics, and then I resorted to substance use, or I did it because other people are using it. So what does that mean? There is stigma around mental health. We have misconceptions and stereotypes. Like I mentioned, people say men do not cry, men must be strong. How do you go to talk to someone? I have seen people in families having marital issues and then they cannot handle the problem. But one of them, I don't want to say the man or the woman, one of them says, no, we can handle this by ourselves. When we don't, it means we are weak. And as they delay handling it with someone else, they are causing more damage in their relationship. Yeah, some of us here now, we are lucky that we can have people to speak to. But even in those generations, they were the singers back at home, the mothers, they used to do that. Unfortunately, now the mothers and maybe the singers, we are not there. Winfred will wake up very early in the morning and I go to work, I come back in late in the night. So you find sometimes you don't even have time for yourself, which is not very good. Then the other thing regarding stigma is the fear of being judged and maybe discriminated. If you mention, I have been handling clients, but if you ever mention that we are going to Butavika, there are very few who take it positively. And yet Butavika is one of the places which is supposed to support our mental well-being. So we fear being judged. I'll be called a mulalu. And yes, your mental health is not normal. You are not functioning very well, but it does not mean you are this person who is, even if you are undressing, you need help. So sometimes we fear that judgment. How will this happen? How will my family know? How will that business of this and that? Then there is also the impact of stigma on seeking help. Some people don't want to seek help just because they know they will be stigmatized. So you realize that it is very important for us to raise mental health awareness. If we can raise mental health awareness, we shall reduce stigma and possibly ensure early interventions. It is better to do early interventions, and sometimes I really prefer to prevent. Here we are, as you go out, you talk about mental health, you are raising awareness, you are going to prevent mental health illnesses. But if it has happened, let us at least ensure early intervention. And then we want to have mental health awareness such that people can talk about it normally. Let us normalize it. Let us encourage people, our colleagues, others to seek help. That would be very important. I sometimes refer to some celebrities. I see Stella Nyanzi. I am sorry, some people may not want to hear about it, but I read this as an academic activist. She had been involved in discussions which were looking around mental health, and it was actually concerning her personal experiences. That was, I think, way back in 2017. So during the legal proceedings, there were debates about her mental state. I imagine many of you heard about it. Bringing attention to mental health issues, we need to really mind over the political activism. So sometimes people would be like, I think this one is like this. But sometimes it is affecting an individual's well-being. It is good for individuals to come out and say, yes, this is me, and this is how I feel, this is how I think, and therefore, this is how I behave. Then why, when we have these mental health issues, what is it we need to do? We need to look at coping strategies so that we can have good mental well-being. One of them is to do with the lifestyle, the healthy lifestyles. You can have the regular exercises, and these exercises will help you improve mood. You can manage your stress. You can have, these days we are lucky. The .com era has come up with the AI, has come up with the Google. You can have apps that will help you with mindfulness. However, I want to still say something regarding this. There are some people who have gone into the social media, those apps, and have forgotten that we are also there for physical attention. There are some things which really need physical attention. And this takes me to seeking support, the physical support. You look for therapy. You look for someone to counsel you. Talk to a friend, but please talk to a friend who you trust, because you may tell your friend, that someone you call a friend, and this friend is instead going to cause you more emotions. So mind of the person you talk to about your mental well-being, but it is okay to seek help, and the professionals are there. I did not mention that I'm also a board member, Uganda Counseling Association, a body that regulates counselors in Uganda, the counselors and counseling psychologists. So if you just called me, I would actually attach you to the administrator. Winfred might be busy in Chambogo, or Winfred, it might be an issue that she will not handle, and then I refer you to another person. The counselors are not working in isolation. We have Dr. Juliet in Butabika. There are many other centers that we have. In Chambogo, we have Safe Places. We have of recent, Dr. Kalema opened up his center in PG here, Hope and Beyond. We have many rehabilitation centers where we can refer you for support. We have the psychiatric doctors, the clinical psychologists that we work with. They are in position to support you. So don't come to Counselor Winfred and say, this is enough. No, because mental health issues, we need a combination of professionals. Then we can also cope by looking at hobbies and relaxation. You may engage in creative activities that can help you reduce stress. I know there are some people who, when they are feeling low, they want to lock themselves in houses, on bedrooms. Oh, at least maybe you can go for a ride. You can play football and many others. When we look at the biblical concepts, we have Philippians 4, chapter 6 to 7. He's saying, do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your request to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Jesus Christ. Hallelujah. I am expecting to hear amen.
Amen. Amen.
Thank you, thank you, thank you. So what does it mean? Even the Bible. Unfortunately, I don't have the Quran here because I believe in integration. Yes, I integrate the biblical concepts, the Islamic concepts, and then psychology concepts. So if we are talking about being anxious, and the Bible is saying, do not be anxious about anything, it means it is somehow helping you on how you can cope with the situations. So we need mental health support and resources. I've already talked about the therapy. When I talk of therapy, these counselors, the psychologists you see, have many approaches. For example, one can say, I'm going to use the CBT, cognitive behavioral therapy. If Winnie is thinking irrationally, let me rationalize her behavior. I mean, her thinking. What about her behavior? What is it I'm going to do such that she can change behavior? And as she changes behavior, if she has been drinking a lot, if she changes behavior, it means it is going to stop her from using drugs that could easily cause mental health issues. Then we have helplines in times of crisis. For example, we have the Alcoholics Anonymous for substance use. We also have online mental health forums for peer support. I normally refer some people to Strong Minds Uganda because they have dealt with depression very well. They have also supported us in Chambogo University with our students. So even the Bible again says, seeking support is a sign of strength. So when you seek support, don't think you are weak. And Ecclesiastes 4:9-10 says, two are better than one, because they have a good return for their labor. If either of them falls down, one can help the other up. But pity anyone who falls and has no one to help them up. So as we look at this peer support, peer, it means wherever you are. If you are at home, who is your peer? You are at the place of work, who is your peer? And we are talking about the therapist. Have you ever identified a therapist? Have you anyway been for counseling in case of any problem? Some people don't want to be seen as weak. That's why Ecclesiastes is saying it is okay for you to go for support. But pity anyone who falls and has no one to help them up. So please look for people to help you up. And what are some of these support? Here I'll go a bit slow and say, Counselor Winfred. My students usually call me Winnie. It's okay to make me a young girl. Counselor Winnie is on a telephone number. I feel bad that my screen can't be seen. 0772 360-111. Jethro, if it is okay, please put it in the chat. 0772 360-111. I want to say that sometimes I'm very busy. I'm a government worker, but at least you send a message. I will refer you if I cannot make it. Instead of dying alone, I normally tell my students, don't call me at midnight. But if it is an emergency, please call and I help you. It might be an emergency and you need immediate help. We also have Mental Health Uganda helpline. Jethro, thank you. You can as well type this 08. Jethro, are you with me? Still in the chat? 0800, or maybe I will share again, but it is 0800 212121. 0800 212121. You can be supported. We have Butabika toll free. He talked about it. You talked about Butabika, Peter. Oh, the helpline is 0800 212121. 21 is times 3. Then Butabika toll free, we can still get it from Peter because I have sent him this presentation. We have Strong Minds Uganda, where you can send messages, SMS. You can use an SMS, *252#, and of course you enter *252#, and you enter. I am giving these contacts because sometimes you want to reach out to a professional counselor, professional doctor, and maybe you are not in position that another person can easily help. However, the Strong Minds Uganda, the SMS, it might take time. I will check for the telephone number later and share with Peter. Then we have Sauti Child Helpline. Many of us out there, we have children. You don't know what is happening, or you might even find a child on the road and looks really is mentally unwell. It means that child can even be supported by Sauti Child Helpline. Of recent, I had a maid who had a problem. Much as she had passed the 18 years, I took her to Sauti Child Helpline and I was supported. So the helpline number is 116. Sauti, we have the offices in Chireka, where there is a rehabilitation center. Those of you who know Chireka very well, 116, and then the SMS to the Sauti Child Helpline is 8500. 8500. 0. So what does it mean? We are trying to look for support resources. Then I will have a small conclusion here and say that mental health is a crucial aspect of overall well-being. You cannot say I'm physically fine when upstairs you are not okay. You may look fine physically, but when I want to call it that powerhouse, the mental health is not there, then even other issues will disappear. You will cease being social. You will cease being physically fit, because you have seen some people who are mentally ill, either they are very tiny or they are very fat. So it is a crucial aspect and affecting how we think, we feel, and interact with the world. So you need to know how I think. Am I thinking positively? Am I feeling positively? Am I socially fine? And then we need to explore the importance of mental health, and we need to raise awareness. What is the impact of stress and anxiety? What about the strategies? What about self-care? You may be stressed, you have had a lot of work, or your desk has been too full from January to January. You need self-care. You need to take a break. You really need to speak to someone. And of course, you have to prioritize your mental health for balancing your life. If your mental health is not fine, then how is your physical going to be fine? That is why you can afford to reach home and everybody you are seeing, you are shouting at him or her, because your mental health is not fine. So I will say it's okay not to be okay, and it's okay to seek help. So we shall call for action, and we say, number one, we need to break the stigma. Let us speak openly about mental health and encourage conversations, and we also encourage support. We need to practice self-care. Members, let's not wait to go to drink ourselves off. Some people will want to go to the bars and drink, but we are saying engage in mindfulness, exercises, and activities that promote mental well-being. What about seeking support? I've been saying it. Reach out to professionals, reach out to a friend, reach out to groups when you need the help. Don't look at yourself as a very strong man, a very strong woman. You equally need help. Then spread awareness. We are here. We need to spread awareness, share knowledge, share the resources like I have shared with you, and then we shall understand the importance of mental health. I want to thank you for now, and remember that we are here for mental well-being, which is like a garden. If you water your garden very well, in this heat, some people are enjoying greens, others are not. So mental health is like a garden. If you water the garden very well, with love, with enough water, you will refresh the crops and you will nurture it with patience. And then you will weed out misconceptions. You will weed out the non-essential crops that are growing there. You will have the weeds out of your garden. So let us weed the gardens, our brains. Our garden now is the brain. We weed the garden, then we can be in position to have a good yield. Thank you very much. Apologies for failure to show this on screen.
Thank you very much, Councillor Winnie. Thank you for your presentation. I would like to open the floor now to Q&R or Q&A session. Gentlemen and ladies, if you have any question, sorry, somebody called. Yes, if you have any question regarding mental health, please feel free to raise your hand, or you just unmute and ask and have your say. All right. Do we have any questions or any comments, observations, or inquiries that you'd like to make? The presenter is still here. Yes, you can just raise your hand and please. Yes, Wanda. Wanda, you may unmute and have your say, please. Wanda, can you hear me? Could you unmute, please, and have your say, please? Okay, probably Wanda could be facing technical challenges. Yes, Wanda, if you could hear us.
Yes, okay. If at all. Hello?
Yes, Wanda, please go ahead.
So if a client is facing a challenge with stigma, that's to say we deal with the privacy of the traumas that they are going through, wouldn't that also affect the way they would perceive the therapy that will be provided by the counselors in that aspect? Yeah, I beg to submit.
Okay. Yeah, Counselor, you only need to take note. Probably I will invite you so that you respond after a series of questions. Yes, any other? Any questions or any comments?
Peter, maybe I could say something as we wait for the others.
Yeah.
Can you hear me?
Yes, please. Yes, we can hear you loud and clear.
Yeah, Councillor Winnie, men, okay, it's been said that men don't like to share. They don't like to share what's deep in their heart, you know. They rather die with it as men and things like that. But there's a trend where men either go to bars or, you know, these places where men hang out really, and somehow they share in those places, typically with strangers even. What they find hard is to share maybe with the people who are close to them. Unlike women, who would probably call up their best friend or mother or something like that. Men typically don't call their friends. Why do you think that is the case? And what can they do about that? Because we know they all need help, just like the ladies. The ladies live longer than us, I think, because they share more than we do. Many of us just die like, you know, like you want to die like soldiers without sharing anything. Yeah, so some advice for men in that regard.
Okay. Any other question? Yes, yes, Councillor Wina, I also have a question. Number one, when I am mentally well, in what state am I? When I'm mentally well, in what state am I? Are there indicators for my mental wellness or my mental health? You say I'm healthy mentally. And so are there indicators? That's number one. Number two, when I am mentally unwell, could there be, what do you recommend to be the first aid? when I realize, now that you will give us the indicators of mental unwellness, and if I realize I am mentally unwell, do we have any first aid steps? You know, do this, do that. For example, when you're challenged, if you're in a marital relationship, or if you're in any relationship, you know, opposite sex relationship, and you're finding it troublesome, or you're spending sleepless nights out of the 18 hours or the 13 hours of the day, 12 hours, your brain keeps on lingering there, or your thoughts keep on lingering there. So what do you think? What are the first aid steps that one might take when they realize they're anxious, they're stressed, they're depressed, they're worried, they're full of fear? Okay, they're full of fear, and it has become chronic. Fear to them has become chronic. Are there baby steps or first aid steps that one might take. Yeah. Let me hope, Counselor, you're taking the questions. Do we have any other questions? Okay. Yes, Counselor. Could you now respond to that bunch of questions you at your table?
Okay, thank you very much, Peter. Before I go ahead, I have one counselor from the unit, and that is Gladys and Nora. So I will request for her input where possible. And I want to thank you for these questions. Mr. Wanda, have I seen a lady on this call? I don't seem to see a lady apart. Oh, maybe Merisha.
Merisha is
welcome. Okay, I'll begin with Mr. Wanda. If a client is facing a challenge with stigma, won't it affect the counselor's interventions? The very first thing counselors do is to, first of all, assure confidentiality. And I want to say come these clients may not even understand there is a problem. So the fact that this person has come to me as a counselor, and the fact that I'm taking him or her through a counseling session, there is a lot that we are going to share. For example, as I create rapport, through that time, that very first phase, I may be in a position to help this client feel comfortable with me. Definitely, with the stigma, it is something, there is self-stigma, that is the internal, and then the external. So if this person has gone to a therapist, a counselor, who understands what it is to be stigmatized, then will be taken through, and to a certain extent, this client will feel comfortable. I want to say that the sessions are between a willing client and a willing counselor. I will give an example. Before I joined the counseling unit, I used to teach guidance and counseling as a course unit. And I would tell the students, please go visit the counseling unit. Then they would tell me, Madam, we don't have any problem. I would say, please just go. And the counselors who were there would just speak to them, and these students would be like, you know that phenomenon. You mean there is this and this? Then they explore their issues. So the stigma bit of it, it is also us, all of us on this call, to raise awareness. When we get to know, remember that time when HIV had just come, they would just drum, and you hear that drum on the radio. And everybody would be like, Mukenenya, Kasilimu, Bichi, you get me? So if we can raise awareness, then the stigma will also go. Definitely, this is something which is gradual. It doesn't happen in 1 day, 1 minute. Jethro, men don't like to share. I want to say, if I have said it, I want to say it is a fallacy of generalization. Not all men. Some men share. He's surprising me by saying they go to bars and share. But I'm telling you, as far as I know, alcohol and other substances, when you take them, they alter your thinking. So I do not know whether this is very okay. Someone can go to a bar and have concrete internalization of a problem. I'm wondering whether the advice they get is very good advice or not. I'll give you an example. I told you I'm a marital counselor. If someone comes and says, hey, my wife is cheating on me, and then the other one will say, if the wife is beginning to cheat on you, you better also you find some Panadol outside. Would that be rational? So by the time they go to their colleagues in the bars, and then they begin getting advice, I'm not sure of the advice that has worked at the influence of alcohol, whatever it is. But otherwise, Councillor Gladys is also here to support us and let us know. Peter, you said I am mentally well. What is the state? There is, unfortunately, the slide is not there on the screen. And I think we said when you are well and when you are not well. If you are isolating yourself, you are not concentrating. We said here, signs and symptoms of poor mental health. You are into sadness. You are failing to sleep or eat very well. It means you are unwell. Because you asked, what state am I? What are the indicators if I am mentally well? If you are mentally well, it means you will do your work as usual. You will be interested in your activities that you have been doing. You will concentrate at the place of work, even when your dean comes and says, Peter, I need this quickly, very fast. But if you are mentally unwell, it will take time for you to think through and concentrate. If you are sleeping very well, it means even when you go to the place of work or you go to class, you will be productive. So the opposite of the poor mental health is the good mental health. You went ahead and said, what is the first aid? I have also mentioned the exercises. By the way, many times when I get clients who are anxious, you talked about anxiety. When they are anxious, the very first thing me as a therapist I do is to see if I can have a simple exercise. Breathing in and out is one of the exercises that has supported my clients. And even before you ask them, they are telling you, now I feel the chest is opening up. You know, when we are angry, we are anxious, you have all that anger in you, you feel like boxing even walls. But when you go through the exercises, you go through meditation, then we also have what we call talk therapy. That is why I kept saying, if the women, he mentioned it, Jethro mentioned it, that we talk a lot. As you talk, it is a therapy. And as you talk, I may be crying. That's why for us counselors, we are not worried of the tears because we feel it is something which is helping the person to heal. So there are some of the exercises you can have. Talking to a peer, talking to a friend can be fine, but that friend might not be professionally okay. So it means look for the counselor. And these counselors are not going to work alone. I'll give an example of some of the clients we have handled, let me now say in our unit. You realize there are some you will handle, have talk therapy, do diagnosis, assessment, and then maybe at a certain time, refer to the medical doctor. I'm happy to note, at least in Chambogo University, we have doctors who appreciate mental health. We even have some starting medication. However, most of these mental health issues, some of them, especially among our students, they may not even need medication. And of course, even if I knew what to do as Winfred, a counseling psychologist, I wouldn't do what? I wouldn't prescribe any medication. So we work hand in hand with other professionals. Some of them, it is just to have a support system. I had a client who wanted to quit alcohol. He was trembling, and all he could say, my friends give me money to buy mwenge, but they don't buy me food. So what does that mean? This person has a will to quit the drinking. So the first aid can be looking at other significant people in your life. So, but that one will not happen if the individual has not sought support. So there are a few of those exercises we can do. The talking, others you let them cry, and meditation is very important. Like I have used Bible quotations here. You can even look at the Bible. That's why we say integrating biblical concepts with the psychology. You mention a word and a text, and someone is like, wow, okay. Someone is coming and is telling you, my father doesn't love me. Go to the story of the prodigal son. And then it's like, Wama, what does it say? So somehow those are things that bring back their memories or our indication, our importance of mental health. But it will also matter what kind of mental disorder. There are some, Winfred as a counseling psychologist, I will automatically say, this is for Dr. Grace in the medical center. I will not handle, because we do not have to stick on some of these cases that can easily become worse. I want to thank you, and I'm waiting for more questions. Thank you. Maybe Councillor Gladys, would you like to say something?
All right, thank you. Thank you, Councillor Winfred. Thank you very much. I don't know whether people have other questions. Please, if you have a question or if you have a comment, I would like to welcome Davis Wasadja Ntale. Davis is a graduate of psychology. I don't know whether he still practices counseling or psychotherapy, but is a graduate of psychology and is one of our psychologists on this call and this fellowship. Unfortunately, you have come late, but we really wanted you here. The Davis Wasadja Ntale, are you the one we know?
Yes, please. I am the one you know. Thank you very much.
Yes.
So I've come in late.
Yes, you're very much welcome.
I'm sorry, Peter. Gladys says she needs to be unmuted.
Really?
I see it in the... Yeah. Is it me? Is it Jethro now?
I think it's Jethro to unmute.
Unmute Councillor Gladys. And Davis, you are welcome.
Thank you, thank you, thank you.
Councillor Gladys,
Yes.
I cannot. You have to unmute yourself.
Okay.
We can go with Davis.
Okay. Yes, thank you very much, Davis. Thank you for turning up, and thank you, Councillor Gladys. Thank you, Councillor Winnie. Now, there is something I've realized, and this goes to the three councillors at least resident now here on the call. I've realized that you can know of somebody whom you consider to be a well-thinking member, a person of intelligence and of substance, somebody whom you know reasons and could see the world well and come to conclusions, reasonable sounding conclusions. But with time, that ability keeps on getting eroded. In fact, without their realizing. And probably you discover that something is going wrong with their mental health. And let me not put it far away. Let me probably bring it to myself. And then, how do you become conscious that that your mental health is getting wanting? you know, because like people who get drunk, somebody who gets drunk and say, I'm a very sober. You look at this one who is drunk, and the drunken person feels sober, and even mad people feel well. And I think it is a syndrome to most of us, if not all of us. You think you're well, you think you are in control of your mind, you think you're in control of your reasoning, you think you're seeing the world objectively, and you think you're reasonable. Yet, when analyzed, you have something missing. So, are there indicators? Probably. I mean, how do I get conscious of my mental state? Yes, Councillor Winfred, would you like to go first?
I see Gladys trying to open her mic. Let me leave her to go first.
Yes, Councillor Gladys.
Yes.
Yes. Have you heard my question?
Yeah, there is a continuum that we can go by, or there is something that shows you these different indicators according to the different mental health state. And they can only say these signs. You can actually see, even when you're not able to see them yourself, the people you live with, because I believe we don't live in isolation, will be able to tell that, you know, this, we've seen you do this often. What is happening? They can keep you in check. Sometimes it is those people that we live with or that we work with that are able to put us in check. I used to live with somebody who developed dementia, but she could not tell that actually she's beginning to forget so many things. But every time you would put her in check, she would be able to know, you're very right. I never used to act like this. So when you're in crisis, you find yourself being very anxious. You find yourself in a very low mood. You find yourself being absent in the most important things of your life, exhausted and having very poor sleep. Sometimes people get weight loss. Those that are struggling, they become anxious, depressed, tired, get poor performance in everything at work, at home, at school, whatever you're doing, and poor sleep and poor appetite. When you're surviving, you are worried, you are nervous, you're irritable, you're sad, just like you're on a borderline, you're just surviving. And you get distracted very easily, or sometimes you withdraw. Then when your mental health is thriving, you will be positive in many things that you do. You find yourself calm, performing, sleeping well, eating normally, and normal social activities. You're involved in the normal social activities, like Councillor Winfred was telling us. When you begin to withdraw in those social activities, then there is a query. When somebody's mental health is excelling, then they are cheerful, they are joyful, they are energetic, they are in high performance levels, they flow very well in many things, and they fully realize their potential in many ways. So when you go into that continuum of mental health, you understand that it takes, like Madam Winfred was saying, it takes levels. It doesn't collapse one day. And the one way to know is to check yourself. If you're not able to check yourself, then the people that you live with can easily tell. If you have a routine you always follow, check with your routine. Am I able to do this anymore? Then you know there are certain things that you're not capable of doing anymore, and check with yourself what could be happening. If I am grieving and I reach work, if anybody presents something to do with loss, then I get irritated, then I start crying, then I break down, I am unfunctional. It means I'm still grieving, even when on the surface I am looking well. But any trigger that comes my way to do with death, then I break down. I remember the people I lost. then it means I am not capable of handling that circumstance. That's my submission for now.
Wow.
Thank you very much, Councillor Gladys. I want to add on one or two things. First, as you mentioned, we understanding ourselves and other people, it reminds me of the Johari's window. There are many things we know about ourselves. For example, I know Winnie, I am social, I am talkative, I am an outgoing lady. So if I realize I have few words, it means there could be something. Another person might also tell me, I normally ask people, how are you feeling today? And you see someone masking, telling you, I am well. But I would be in position to say, no, Nicholas, you are not well. So when we are with the people, those things can happen. However, there are also blind spots, things which you will not know and maybe other people will not know. And that leads me to now we are lucky that this .com era, we have internet, we do what much using diagnostic tools, we also can check ourselves, reach maybe the Google Chrome and type in a certain test. How am I? You will also appreciate and be genuine to yourself. Those tests are on internet and they can help us work. However, if you feel you cannot interpret them very well, then you don't have to do it because it can cause you more mental health issues. But some people have taken tests and those tests have supported them even before they look for support. However, having someone on board is very important. Maybe Davis can add on that. He doesn't seem to be online.
Yes, I think it dropped off. It dropped off. Yes, yeah, any other questions here or any comments? Umchwezi Rutembana, do you have anything for the councillors here?
Hey, hello?
Yes, please.
Thank you. I have two questions for the councillors. And the first one is on the treatment. These mental illness diseases. What is supposed to be the primary treatment? Is it the medical part where people are given drugs like what they do in Butabika, or counseling? That is the first question. Okay, can I get the difference between the treatment of drugs where people are bedridden, they are put on drips, like what happens in Utabika, then plus the one where counselors come in, or even pastors, or even other people to pray for these people? That is the first question. Now, the other question is on what impact does the personality of a person have in regard to his or her mental well-being? For example, the people who are outgoing, people who are social, vis-a-vis the introverts and the reserved people. Can your personality have an impact on your mental well-being? Thank you.
Wonderful. Thank you very much. Thank you very much. Yes, councillors, can you respond to that first?
Thank you very much. I will begin with treatment of mental illness. Where drugs come in, when counseling comes in, I want to say you can, for example, begin with counseling. If someone is not in a severe state, it is okay to reverse the illness. You can begin with counseling and also refer for medication, that is the drugs, the people we shall find there. And again, also as long as someone is getting treatment and is in the right mind, continue with counseling. That is why at one point I said there are situations when I cannot remain with this client to say, I'm Winfred, a counseling psychologist, I will work on this one. No, that is why we work with other medical personnel. So something can start small, but if not handled very well through psychotherapy, then it becomes a problem. So counseling is okay if only it can support the client alone. It is okay together with the treatment, or you can actually first have treatment and then counseling will come later. Why? Because some of these issues are, why someone is sick is because there is an underlying problem. And if this underlying problem is not handled, medication is given, it means this person will not heal, will relapse. So that is why we need to work hand in hand. That is why in Butabika, you'll find the clinical psychologist, you'll find the counseling psychologist, you'll find the psychiatrist. Councillor Gladys, would you like to add on that? And Davis is back.
Maybe to give an example. I once handled a gentleman who was sent from Butabika to go and look for a psychologist because they were dealing with anxiety disorder. And the doctor said medication alone wouldn't help without the counseling because it all needed cognitive restructuring, like working on the mind to think right and so that they can do things the right way. So like Madam said, there are times when you start with the doctor will send you to the psychologist. You start with the psychologist sends you to the doctor, depending on the condition. If somebody is suicidal, you can't keep them on talk. They have to find a medical solution to this. That's my submission.
Okay, thank you. Thank you, Councillor Gladys. Thank you very much. Yes, Priest Mutabazi Tumwine, if you have something relevant to say, please come say it, because I would like to, before I ask mine. Yes, please come in.
Good evening, everyone.
I had two questions. I've only answered one.
Yeah.
Okay. Yes.
The second
yes.
question, she was trying to look at the impact. What impact does the personality have in regard to mental well-being? The introvert and the extroverted person. Is that what you had?
Yes, yes.
I want to say this can be, to me, either positive or negative. What does it mean? I may be an introvert and I am not into this high thing, which will cause me even more anxiety. I may be an introvert and I just keep quiet and then it causes me anxiety. So this depends on our situation. However, definitely the way we handle situations, personalities will matter. If, for example, Winnie, I am facing a problem and I'm able to share, like we said, it is okay to share. That is why we say sometimes a problem shared is half solved. So it depends on what comes on board. You know, like we said, the mental health issues, there are very many causes that lead to that. So it will depend. And the personalities, it is to do with now the therapist to identify. Could it be the personality that is disorganizing this person? Could it be the age? Could it be the birth order? What is it exactly? But we can't take it for granted. We cannot leave it out that personality can either promote mental well-being or promote mental illness. Thank you.
All right. Thank you very much. Pastor White, come have your say. And then later, I'll ask you to talk about the role of spirituality to our mental health, if you will. Please, this is your time.
Thank you very much. Good evening, everyone. I hope you can all hear me. I am a little bit struggling with malaria, but can you hear me?
Yes, we can hear you. Sorry about malaria. Hope it's not affecting your mental health.
No, actually, the discussion has already disturbed my mentality. Because because the Winnie, I hope Dr. Winnie and Dr. Gladys and all the professionals have decided to communicate in a very professional way. But as a layman, I would like to customize this discussion to the African context, because what I hear is the Western approach to this problem. What is the African approach to this problem? Where are we having these mental issues? How were we dealing with those mental issues? Someone who cannot speak this English that Winnie speaks, and they're deep down there in Kachinzi. Kachinzi is where I'm born. How should they deal with these issues, with or without Butabika? What are the lifestyle measures that we should always cultivate to safeguard us from these mental disorders? And once we are already subject to those mental orders, what do we do? What are those local solutions which are custom made to deal with these issues? I think that is, for me, that's why I want to follow. These things are so complex. We are dealing with the brain, I understand, but the brain has been here even before this education. What has happened that is affecting this brain this much, given the statistics that Dr. Winnie started giving us when she was introducing her presentation? Why are these statistics raising, and yet the brain has been here before? Is mental illness a lifestyle problem? And if it is, how can we now deal with that even before we get to the doctors? Because I can see Dr. Win was actually encouraging us. There are many centers, but those centers might even end up being next door. Isn't there any other way? What are the lifestyles that lead to these issues? And what is the African approach to this? Because we used to deal with these issues in our shrines and we could get out all right. We used to deal with these issues. What are the African approaches? What are the practical approaches to this problem? Thank you.
Thank you, Priest Mutabazi. I will say something small, and maybe Gladys. Davis said he cannot unmute. I want to first of all appreciate the African context. That's why I have been saying the .com era. Winnie wasn't born in the .com era. I'll give an example. Some of the tribes in Uganda here. For example, if you lost a loved one and you never cried, they would actually come up and beat you to make sure you cry. That is one way they would deal with grief. And some of these practices have, I want to say, have disappeared because I have seen people die and they hire someone to come cry for them. So you even said the measures and maybe the local solutions. I gave an example. For me, I was born in a family and the courtyard housed, I think, like 5, 6 houses. Long time ago, this child, Winnie, was a child for the community. She would belong to a community. If she runs from this homestead, she runs to another one, and that would be already known. And then the parents would also get concerned if there is another child who is not behaving very well. You asked what has happened. So now you find Winnie is having a baby. When I came to reside in this place where I am, I came with a 6 months old baby. I was still working in Lukuli and Winichambogo. So early in the morning, because I want my bedroom to be secure, I bring out the baby to the sitting room, to the other bedroom. I lock the bedroom. I'm leaving home by 6. And I come back around 9 p.m. I am not there. And possibly, as I say, Winnie, I'm not looking at only Winnie. The person I'm leaving my baby with, when I come back, the first word I say, what are you doing? There is no supper. I want to eat. So what does it mean? We have lost touch. Whether we like it or not, we have lost touch because of, I don't want to say women emancipation when we are about to celebrate Women's Day. But Winnie is in office. The father of the child is in office. The aunties are not there. The uncles who used to sit when we sit around the fireplace are not there. It is causing issues and raising illnesses. Yes, we have the social media. It is both good and bad because sometimes our children are going to the social media and they are getting information. We are not regulating them. We are not monitoring them. When I say we, very few parents, for example, have mechanisms. I will be in office and I see my son's tab, or if he's doing any holiday work, I will see a prompt that something has happened on this phone. How many of us? So these children have ended up finding out information by themselves or by other people. And when they have issues, definitely me as a parent, I'm also getting into the stress. So some of these factors have contributed to that. Nevertheless, we can still do something. What mechanisms do we put in place? If long ago we used to have fireplaces, can't we have something related to that? And we avoid going to Butavika. But if Butavika is there and can also help, then we don't want to see many people on the road who are not doing very well. I will stop here for now, Priest. Thank you, but that is a very good issue that you have raised.
Yes, we have 9 minutes, ladies and gentlemen. Allow me invite Pastor White if you have something to tell us about spirituality and mental health, or what has our God, Christ Jesus, to say about our mental health and well-being. Priest White.
First of all, I would like to let believers know. First, I would like to thank Dr. Winnie. Thank you so much for that presentation, and Gladys and everyone who was here. But first, I would like to make it clear that the Bible is not a medical book, neither is it a psychological manual or even textbook. So, however, the Bible is not silent on the entire framework of a human being, because the Bible believes that a human being is body, mind, and spirit. That's what 1 Thessalonians chapter 5, verse 23 says. And because the word of God understands who a human being is, that his body, mind, and spirit. So it does not go into details like the professionals here have done, but it gives principles of living that are going to safeguard your body, principles of living that are going to safeguard your spirit, and principles of living that are going to safeguard your mind. So that's what the Bible does. First of all, the Bible emphasizes that you are a creature created by God. There's an authority that takes care of you, and in that sense, it is trying to remind you that you don't have to be anxious. That's the whole thing, whole matter of discussion in Matthew chapter 6. Do not be anxious of what you will eat, the things that actually stress us. God reminds all of us that He is the provider, and He actually challenges our rationale of worrying. At a certain stage, even asked, how many of you, when you worry, you will add one hair on your head? So that's the biblical approach to this whole matter. And then he reminds us in 1 Peter 5:7 that cast all your anxiety on him because he cares for you. So gradually, the Bible reminds us that it is not about us. We are not independent. There's someone who takes care of us. Our problems are his problems. Yeah, so we need to maintain that sobriety always, to be sober. And whenever our minds are filled with this baggage of social media, etc., again, the word of God reminds us in Romans chapter 12 that we should renew our minds always, refresh our minds always. So basically, the Bible gives you principles of living. And then finally, the Bible also reminds us that we were created with a purpose. And some of us are stressed and have hurt our mind and our body and our spirituality. We have hurt ourselves by going astray from that purpose of our creation. So fundamentally, the Bible is about self-discovery. Once you discover yourself, then you'll see that you are in the Lord, because that's the perfect identity that you can ever discover, that you are created in the image of God and you are in the Lord. Discovering yourself, the Bible thinks that will help you get to know what you can stress about and what you cannot stress about. Finally, the Bible in the Christian worldview reminds all Christian believers to always take the right problems to the right pastors. And I normally mention this, but it has caused me problems in my Christian circles. I normally tell people that people like Dr. Winnie, Dr. Gladys, these are counselors. Ladies and gentlemen, I want you believers to understand that these counselors are pastors. So when you have a psychological problem, you take it to Pastor Davis Wasajja, Pastor Gladys Ananura, and Pastor Winnie. Those are your pastors of your psychology. Do not bring your psychological problems to Pastor Isaiah White, because Pastor Isaiah White is ministering in a different office. I normally see people in these counseling rooms, and the issue they have brought to me as a pastor, that's not my office. So I normally advise pastors to always refer these patients to the rightful pastors. And then I also advise the Davis Wasajja, when you have a spiritual patient, please refer that patient to me. Do not wiseacre with your psychology. I am the only person who can deal with that demon. Thank you. I don't want to take a lot of your time. Thank you so much.
Thank you. Thank you very much. I'd like to thank you, ladies and gentlemen. We are 3 minutes away, and I will not add any minute to this discussion. Would like to thank the Lord for Councillor Winfred. We are very much glad. Thank you for honoring our invitation. We'd like to thank the Lord for Dr. Gladys Ananura. We address you as doctors because we laymen think that whosoever treats is a doctor. So don't be offended. All right, Davis Wasaja, we missed you, but thank you at least for securing a minute or two to be with us. In attendance, Tukunda Blessing, I think that is one of my students, Marisha. You're very much welcome. We're always here on Monday. On Monday, we have a Q&R session. Q&R is question and response. If you have any question on life, especially on matters of faith, God, no God, marriage, sexuality, especially with a spin of what God has to say. You're always welcome here. If you have any question, it could be anything biblical or extra biblical. Okay, please join us. It is always the same link and it's the same time between 6 p.m. and 8 p.m. This is In Truth and in Spirit Well of Worship Fellowship. Once again, a round of applause to Winnie, Councillor Winnie and her team. We thank you very much. Come again until we meet again. Well of Worship Fellowship. Christ Jesus is God. Good night.
Bye. Thanks for coming, everyone.
Good night.